Hello everyone. Today we will explore some practical tips for managing diabetes in older adults. Diabetes is not just a health issue that needs to be controlled, but also a long-term journey that requires taking care of oneself in a scientific and comprehensive way. Maintaining a balanced diet, regular physical activity, stress management, and getting enough sleep all play a vital role in controlling blood sugar and preventing dangerous complications. In this video, we will share advice on nutrition, lifestyle, and simple yet highly effective methods to help older adults with diabetes live healthily and manage their condition better. Let's dive into each step of this health journey together. 1. Dietary control. To manage diabetes effectively, maintaining a balanced diet is crucial. People with diabetes, especially the elderly, should eat plenty of vegetables, fruits, whole grains, and foods rich in fiber. These foods not only help provide the necessary vitamins and minerals for the body, but also help regulate blood sugar levels, reducing the risk of complications of the disease. Vegetables and fruits also help provide many antioxidants, protect cells, and improve overall health. Another important factor in the diet is the choice of complex carbohydrates. Foods such as whole grains, beans, sweet potatoes, and non-starchy vegetables will help maintain more stable blood sugar levels than simple carbohydrates. These foods have a low glycemic index, which helps prevent sudden spikes in blood sugar after meals. They are also high in fiber, which helps enhance digestive function and support weight control. In addition, it is also important to control the amount of carbohydrates consumed. At each meal, you should eat a moderate amount of carbohydrates to avoid excessive blood sugar increases. Limit foods that contain refined sugars, such as sweets, and carbonated soft drinks, as they can cause blood sugar to spike rapidly and become difficult to control. Eating properly and regularly will help patients maintain long-term health and reduce the risk of diabetes complications. 2. Reasonable amount of protein. When you have diabetes, maintaining a reasonable amount of protein in your diet is important, especially for the elderly. Protein not only helps build and restore tissue, but it also plays an important role in maintaining and protecting muscles, which is a very important factor as we age. For older adults, the loss of muscle mass can affect quality of life and mobility. Therefore, providing enough protein in the daily diet is essential. Lean, low-fat, and nutrient-rich protein sources are the optimal choice for the elderly with diabetes. Foods such as poultry, chicken, duck, fish, beans, tofu, and low-fat dairy products such as yogurt and cheese will provide a high amount of high-quality protein without increasing the amount of saturated fat or unnecessary calories. These protein sources not only help the body maintain muscle mass, but also help regulate blood sugar more consistently, as protein does not increase blood sugar levels as quickly as carbohydrates. Besides choosing the right foods, it is also important to divide the amount of protein during the day. Instead of consuming large amounts of protein in a single meal, seniors should divide the protein intake evenly throughout the day, evenly distributing it between main meals and snacks. This helps maintain stable energy levels, avoids hunger or excessive cravings between meals, and supports more effective blood sugar control. 3. Healthy fats. Fat is an integral part of our diet, especially for people with diabetes. However, not all fats are healthy. To protect heart health and help control blood sugar levels effectively, diabetics need to prioritize sources of unsaturated fats. Unsaturated fats can be found in olive oil, avocados, nuts such as walnuts, almonds, and chia seeds, as well as in fatty fish such as salmon, mackerel, and herring. These fats not only help reduce the risk of cardiovascular diseases, but also support the stability of blood sugar levels in the body. In contrast, saturated fats and trans fats are factors to limit in the diet. Saturated fats are often present in animal foods such as fatty meats, butter, fatty milk, and processed foods. Trans fats, found in industrially processed foods such as confectionery, snacks, and fried foods, can increase the risk of cardiovascular disease, while also causing insulin resistance, which increases blood sugar. Although fat is necessary for the body, consuming too much fat, even if it is a healthy fat, can lead to overweight and other health problems, especially for people with diabetes. Therefore, eating fat in moderation is very important to maintain a stable weight and control blood sugar well. The diet should ensure a balance between nutrient groups, helping to support long-term health and prevent complications related to diabetes. 4. Monitor your blood glucose regularly. Monitoring blood glucose levels is an important part of diabetes management, especially for the elderly. When you have diabetes, the body is unable to regulate blood glucose levels effectively, which can lead to serious complications such as cardiovascular disease, kidney damage, and vision problems. Therefore, routine blood glucose checks are necessary to keep blood glucose levels at a stable level and within a safe range. Older people with diabetes need to check their blood glucose levels regularly because their bodies may react differently to food, medications, and other factors such as stress or comorbidities. The frequency of blood glucose tests can vary depending on each person's health condition and the treatment being applied. Therefore, patients should follow the instructions of their doctor or medical professional about checking blood glucose levels. Typically, the doctor will ask the patient to check their blood glucose at least once a day, possibly in the morning when they wake up or after a meal, to monitor the change. For people who take insulin or other diabetes medications, blood glucose testing may be required more frequently to adjust the dosage accordingly. Continuous monitoring helps patients recognize signs of changes in blood glucose levels in time, thereby making early intervention and preventing dangerous conditions such as hypoglycemia or hyperglycemia. 5. Stay physically active. Regular physical activity plays an important role in the management of diabetes, especially for the elderly. Not only does exercise help improve overall health, but it also has a positive effect on controlling blood sugar levels. Gentle physical activities such as walking, swimming, or yoga are ideal options because they help improve insulin sensitivity, help the body use insulin more efficiently, and control stable blood sugar levels. Try to maintain at least 30 minutes of exercise each day, which can be broken down into short bursts, such as 10 minutes at a time, but the total time still reaches 30 minutes. Regular exercise not only helps you maintain a healthy body weight, but it also helps reduce your risk of developing complications from diabetes, such as cardiovascular disease, kidney disease, and eye problem. In addition to gentle cardio exercises, muscle strengthening exercise is also important. These exercises help to increase muscle mass, which can improve glucose metabolism in the body. As muscles grow and are healthy, the body uses glucose more efficiently, which in turn helps control blood sugar levels better. Muscle strengthening exercises such as weightlifting, exercises with machines, or even bodyweight exercises such as push-ups and squats are all very helpful. In conclusion, maintaining a regular and varied exercise regimen will not only help you manage your diabetes, but also provide many other health benefits, improve your quality of life, and minimize health risks. 6. Stress and sleep management. Stress management. Stress is a factor that can increase blood sugar levels in the body, which is very dangerous for people with diabetes. When the body is stressed, hormones such as cortisol and adrenaline are released, increasing the likelihood that the body will not be able to control blood sugar well. Therefore, reducing stress is extremely important to maintain stable blood glucose levels. Some methods that help reduce stress effectively include meditation, deep breathing, and yoga. Meditation helps to relax the mind, reduce anxiety and stress, which in turn helps improve blood sugar control. Practicing yoga not only helps reduce stress, but also improves flexibility, muscle strength, and helps the body relax after a long day. Practicing these relaxation techniques daily will help seniors feel better, while maintaining stable blood glucose levels. Get enough sleep. Sleep is very important for overall health, especially for people with diabetes. Getting enough sleep helps the body recover, regenerate energy, and regulate physiological functions, including regulating blood sugar levels. Older adults generally tend to sleep less, but research shows that they need between 7 and 9 hours of sleep per night to maintain optimal health. Sleep not only helps to refresh the body, but it also helps reduce the risk of diabetes-related health problems such as cardiovascular disease, high blood pressure, and kidney problems. Therefore, maintaining a healthy and quality sleep routine is essential for elderly people with diabetes. 7. Proper monitoring and medication. One of the important factors in managing diabetes in the elderly is adherence to the treatment regimen prescribed by the doctor. Patients need to take the drug according to the prescribed dosage and time to ensure optimal treatment effectiveness. Proper use of medication will help stabilize blood sugar levels and reduce the risk of developing diabetes-related complications, such as kidney disease, cardiovascular disease, or nerve damage. In addition to properly adhering to the treatment regimen, the elderly also need to pay attention to monitoring possible side effects when using drugs. Some diabetes medications can cause unwanted reactions, such as excessive hypoglycemia, nausea, or digestive problems. If experiencing any abnormal symptoms, patients need to immediately notify the doctor for advice and timely adjustment of the treatment regimen. The use of diabetes medications sometimes also needs to change over time, depending on the patient's health status, comorbidities, and changes in diet or lifestyle habits. Therefore, it is important to have regular discussions with your doctor to ensure that the medication always works at its best. Don't hesitate to ask your doctor about any medication-related issues, including usage, side effects, or interactions with other medications you're taking. Finally, the elderly need to regularly check their blood glucose and monitor their health status so that the doctor can adjust the medication in time, ensuring that the treatment process is always effective and safe. 8. Implementing the nutrition plate method for diabetics. The nutrient plate method is a simple and effective way to help people with diabetes control their blood sugar levels and maintain a balanced diet. Under this method, your meals will be divided into 3 main sections, making it easy to control the amount of food and nutrients you need. First, **, 50% of your plate should include non-starchy vegetables. These vegetables, such as green vegetables, carrots, broccoli, or cucumbers, are rich in fiber and vitamins, but they are low in carbohydrates, which help control blood sugar levels well. Non-starchy vegetables also provide many antioxidants and minerals, supporting heart and digestive health. Next, **, 25% of the plate should be devoted to lean protein. Healthy protein sources include poultry, such as chicken, turkey, fish, eggs, beans, and tofu. Protein helps the body maintain and regenerate tissues and muscles, and creates a feeling of fullness for longer, reducing the risk of cravings for unhealthy foods. This is especially important for seniors, helping to maintain muscle health and control weight. Finally, the remaining 25% of the plate should be healthy carbohydrates, including whole grains, such as brown rice, oats, sweet potatoes, and legumes. These carbohydrates are high in fiber and slow digestion, which helps stabilize blood sugar and provide sustainable energy throughout the day. Applying this method not only helps maintain stable blood glucose levels, but also ensures that the body receives enough essential nutrients such as vitamins, minerals, and fiber, thereby improving overall health and preventing complications of diabetes. So, we've learned the basic principles of managing diabetes for older adults, from a healthy diet to a healthy lifestyle. These tips not only help control blood sugar levels, but also lead to a healthier and more proactive life for those living with diabetes. Remember, adjusting your eating habits, maintaining physical activity, and monitoring your health regularly are crucial factors in managing diabetes. Always keep in mind that you're not alone on this journey. With support from healthcare professionals and positive lifestyle changes, we can live healthy and happy lives, despite the challenges of diabetes. Thank you for watching this video. If you found the information helpful, don't forget to share and subscribe to the channel for more health tips. See you in the next video.